Welcome to the Healing Corner, Connecticut's premier medical marijuana dispensary. We are happy to have you. Connecticut's medical marijuana program requires dispensary pharmacists to aid in patients during their medical marijuana experience. We assist each patient with defining their symptom goals, product selection and dosing, possible drug interactions, as well as continued product selection through advancement in the program. The two main active ingredients in our medical marijuana products are THC, or tetrahydrocannabidiol, and CBD, cannabidiol. Next, we will discuss the THC marijuana strain types. THC causes the euphoric or the psychoactive effect associated with marijuana. The three types of marijuana strains that we're going to discuss today are indica, sativa, and a hybrid, which is actually just a cross between an indica and a sativa plant. The sativa plant typically produces a cerebral or head sensation, typically felt in the mind. This can help improve mood and focus. It is more commonly used during the day. A tip for remembering sativa is sativa stimulant, more uplifting strain. On the other hand, the indica plant typically produces a full body sensation. This can help improve chronic pain, sleep disorders, tremors, anxiety, and increases the appetite. It is typically used in the evening or nighttime because it can produce a more relaxed or sedated feeling. A tip for remembering indica is indica in the couch. A hybrid plant is a cross between both the indica and sativa plants. The effect of a hybrid is both cerebral and body sensations. A sativa dominant hybrid is best used for mood enhancement with pain relief. An indica dominant hybrid is best for evening pain, relaxation, and sleep. A 50-50 hybrid is best for a balance of both alertness and body relaxation. CBD is non-psychoactive and does not cause a euphoria. It can be used for pain, inflammation, hyperactive bowels, stomach issues, nausea, anxiety, and for seizure control. It can be taken day or evening. The recommended starting dose for ingesting or sublingual CBD is 10 milligrams 2 to 3 times daily. For CBD, the best results are typically seen after ingesting or sublingual CBD for 1 to 2 months. It is available in all dosage forms, including inhalation, sublingual, and ingestion. Now that we've discussed our active ingredients, we're going to discuss the available dosage forms in which these active ingredients are available in. First, we will discuss the inhalation method. These products are inhaled and absorbed rapidly through the lungs. They are best used for an immediate effect. They typically work within 1 to 5 minutes and last only 1 to 2 hours. Flower is the raw plant material which is trimmed and packaged by the grower into 3.5 gram containers or 1/8 of an ounce, or they are occasionally packed in 7 gram packaged Ziploc bags. Less expensive flower options include second cut, which is when the flower is trimmed and parts of the plant fall off. This residual plant material is then packaged in the weight of 3.5 grams. Select grind is the flour ground up very fine and packaged in a weight of 3.5 or 7 grams. Pre-rolled cones is the raw plant material ground up and packaged into paper cone containing a filter mouthpiece. Slim vapes are disposable marijuana oil devices that contain roughly 40 to 50 inhalations. They are then discarded after completely finishing. Vape cartridges are filled with marijuana oil and must be attached to a battery for use. These contain more oil and approximately 150 to 200 inhalations per unit. Vaporizing pure cannabis oil eliminates the inhalation of carcinogens, including carbon monoxide, tar, and butane, from smoking. Concentrates are products typically for experienced users with a higher tolerance. They are 3 to 4 times more potent than flour. They are used with a special vaporizing device. The next dosage form we are going to discuss is the sublingual option. They typically begin to work within 15 to 20 minutes and last around 3 to 4 hours. These products are used under the tongue and are absorbed rapidly through the mucosa in the mouth. Breath strips can be placed under the tongue and they dissolve and the medication is absorbed. These strips can be cut in half or even quartered depending on the dose per patient. Breath sprays have a peppermint or flavored base and are sprayed directly under the tongue or even on the side of the cheek and are absorbed. Tinctures are drops which are again placed under the tongue. It is best to use a few drops at a time to avoid too much volume which ends up being swallowed. The next available dosage form is ingestion, actually swallowing the product. These products are ingested and are absorbed through the stomach, intestines, and liver. This dosage form takes the longest to begin working, however, it provides the longest lasting duration. Typically, the ingestion method will begin to work in anywhere from 1 to 2 hours, depending on the patient's metabolism, and they last roughly 4 to 6 hours, depending on the dose. It is very important to discuss dosing with your pharmacist before trying this method. Edibles. In the state of Connecticut, Connecticut only allows cookies, brownies, honey, and granola. It is against our state regulations to have candy or soda, and this includes gummies. Capsules and tablets work the same way as the edibles without the added sugar. Tablets can be broken into divided doses. Oral solutions are liquid drops that are placed directly in the mouth or mixed with a liquid such as juice and swallowed. Oral syringes contain concentrated cannabis oil and again are placed directly in the mouth and swallowed. Topicals are applied directly to the skin and they are minimally absorbed into the bloodstream. Therefore, they typically only work where they are applied. Creams, lotions, and oils can be used for pain, inflammation, or to treat various skin conditions. The pharmacist can make recommendations for different types of cream depending on the condition that the patient has. All of our products here at the Healing Corner are pre-packaged and labeled by Connecticut's medical marijuana growing facilities. These facilities include Advanced Grow Labs, located in West Haven, Curaleaf, located in Simsbury, Connecticut Pharmaceutical Solutions, or CPS, located in Portland, and Theraplant, located in Watertown. Each product is assigned a DCP, or Department of Consumer Protection, approved name, the first word being the growing facility in which the product came from. Next would be the DCP approved name of the plant in which the product came from. The potency will begin with a T for THC or C for CBD. Next is the NDC, which is only used for the dispensary staff to keep track of products. And lastly, being the weight of the product. Next, we will discuss the different ways that you can order your medical marijuana product. Please allow a minimum of 30 minutes before picking up your phoned-in order. Canna-Fill is the Healing Corner's online ordering system. Simply visit our website at www.thehealingcorner.com. Here you can place an order using this online ordering system. Simply add things to a cart and submit your order. Please allow a minimum of 30 minutes before picking up your order. All orders will be held for a maximum of 72 hours. To place an order in the store, an appointment is not necessary. An in-store order form will be provided upon arrival to the dispensary. Simply circle which items you would like to order and hand it back to the dispensary staff when completed. The dispensary team will then simply fill your order within minutes. Simple questions can be answered on site. However, if you need help placing an order with a pharmacist, please make sure to set up a purchase consult by calling a few days in advance. When using the in-store order form, you'll notice that each product is sorted into a dosage form category. You will then notice that each product has a letter after the name indicating the strain type: I for indica, S for sativa, H for hybrid, and CBD for CBD strains. Next, we will discuss your monthly product allotment. The certifying physician will assign each patient a monthly allotment. The typical and maximum allotment per patient is 2.5 ounces or 70.87 grams in a 30-day period. Your allotment begins from your very first purchase date, and it resets every 30 consecutive days. Each product is assigned a product gram equivalence, which indicates how much it will take off your monthly allotment. This can be noted on the label in parentheses. A patient can order products over the course of a month with frequent visits or simply just once a month. There is no limitation on how frequently a patient can visit the dispensary and purchase. Lastly, let's go over some key points from today's patient orientation. The two main active ingredients in our medical marijuana products are THC and CBD. The THC causes a euphoria or psychoactive effect, and CBD is non-psychoactive. THC is available in 3 types of marijuana plants: indica, couch, sativa, your stimulant, and hybrid, which is a blend between both. THC and CBD are available in dosage forms such as inhalation, sublingual, ingestion, and topical application. It is important to try different strains and dosage forms depending on your condition and what you are comfortable with using. A pharmacist is always available to recommend products and dosing. This is a learning journey. Don't forget, in the beginning first few months, you're going to try different products to figure out what works best for you and your lifestyle situation. We hope you are ready to begin your medical marijuana journey here at the Healing Corner.